CBS 5 investigates conflicting information, confusion, and concern. 3 months after the FDA said they would not recall textured breast implants linked to cancer, there is now a recall. The number of reported deaths from this cancer has nearly tripled, and now Allergan is offering to replace their textured implants. But is that safe? Tonight, CBS 5 Investigates consults a surgeon for insight on what women should know.
Information is power, and you bring that to the doctor and say, are you aware of ALCL, and could this possibly be BIA-ALCL?
Dr. Joseph Berardi has more experience than most surgeons with the cancer caused by breast implants. Of the less than 600 cases reported worldwide, he's treated 4 of them. Is this cancer difficult to diagnose?
Not difficult to diagnose per se, you just have to be aware of the symptoms.
Berardi says BIA-ALCL typically has 2 main symptoms: fluid accumulating around the implant, which makes one breast larger than the other, and the scar tissue around the implant hardens and thickens.
It's going to be notable. Firmness of the breast, enlargement of the breast, discomfort in the breast.
This breast over here looked fine in the mirror, and this one was higher up and bigger.
In a previous CBS 5 investigation, we spoke with Joanne Chaplin-Schumann, a patient of Dr. Berardi. He was the 5th doctor she consulted, but the first to know how to treat her cancer. The second doctor that you saw was a plastic surgeon.
And he kept staring at it, you know, like he's never seen anything before.
And the 3rd and 4th doctor you went to see were a radiologist and a surgeon.
We are going to give you radiation and chemotherapy head to toe. We're going to knock this thing out.
On the recommendation of the surgeon, you went to see a 5th doctor.
Yes. He said, I'm going to take care of you. We're going to remove the whole thing. You don't need either radiation or chemotherapy, and you're going to be fine.
What is the treatment if somebody has BIA-ALCL?
Recommendations are removing the textured implant, as well as doing a complete capsulectomy.
A surgery that involves removing the implant and all the surrounding scar tissue, known as the capsule.
In most cases, curative.
So if caught early enough, if you take out the scar tissue, the cancer is in that scar tissue?
Correct, correct.
What happens if the cancer is not caught early enough?
There is potential for disease to spread.
We are now seeing a sudden increase in the number of cases of BIA-ALCL reported worldwide. Since 2011 through May of this year, the FDA acknowledged 473 cases with 9 deaths. In the last 3 months, with increased awareness, reported cases jumped to 531. But most notable, the number of deaths shot up to 33, a 266% increase. Cases of this cancer being missed are not isolated. We found an example in the FDA's database. A patient's swollen breast was drained 6 times over 4 years. The implant was finally removed, but the tissue was left in. More than a year later, when the BIA-ALCL was diagnosed, the patient had to undergo chemotherapy. Allergan's recall takes certain textured implants off the market, but the FDA does not recommend women remove their implants. Dr. Berardi emphasizes this cancer is rare and says awareness is the best treatment unless a woman shows symptoms.
If you are asymptomatic, there's no indication to remove the implants. I know it's a little hard pill to swallow, but there are risks associated with any surgery you do, even if everything is perfect.
The recall only covers BioCell textured implants that are made by Allergan. And for a limited time, the manufacturer is offering to replace these textured implants with smooth implants. But an important note, Allergan will only cover the cost of the implant, not the cost of the surgery. And for women who do develop BIA-ALCL, the company will cover up to $7,500 in surgical fees. But again, this cancer is rare. It's estimated 35 million women have breast implants, and there are currently less than 600 cases of this cancer reported. So this is something to be aware of and find an informed doctor who doesn't write off the risks.